So now what you've been, so now we'll get to what you've been waiting for, which is the tips. So Megan is going to take it from here and take you through some tips for writing and speaking clearly about health information.
Okay, great. Our recording actually just started. So for anyone who is watching the recording, we are about 20 minutes into the training. We just gave some background on what health literacy is, why it's important, and a framework for using health literacy. But really the meat of the training starts now. So it's okay that we, that we're starting the recording. Hopefully these tips are helpful to you. So we are going to cover 9 tips. Each tip covers some kind of micro tip. So it's actually more than 9, but don't worry, we're going to also send out a summary sheet, like a 1-pager after the training. So it summarizes what we're covering. So feel free to take notes, but you will have a sheet to help you after. So let's look at how to clearly write about health. So these are 6 helpful tips for writing clear health information. We're going to cover the first 5, and we're not going to cover the last items. We just don't have time today around numbers and risk. So how to talk about data, which is really important, especially in the pandemic with vaccines. But we can cover that in a future workshop in our series if there's interest. So the very first question to ask yourself when you're developing a clear or a health material, and this can be a social media post, this can be a resource, a fact sheet, a website, it can be any type of writing that you are putting in place for the clients that you serve, is to ask yourself some questions about your audience and your purpose. So questions to consider are, what does your audience know about this topic? What does your audience know about the risks of the health behavior? How does your audience feel about the topic? What are their religious, cultural, and other beliefs? And have others in their circle of influence, their communities, had positive or negative experiences with the topic, such as COVID vaccines? And that's going to help you kind of tailor and tweak your message to hit upon those really important ways that they might receive your information. And we love to hear about who you serve. So I did read through everyone's roles, everyone who wrote in, so thank you for sharing that. If, as we're going here, if you'd like to share the audiences and the groups that you work with and just kind of throw it in the chat and we'll read through that as we're going, that would be interesting for everyone to see the variety of people that you're working with. And then either online or in print, there should be no question about what your material is about. In most materials, you want to show the purpose in the main title, and in emails, you want to put the purpose in the subject line. Here's a landing page for a website. What do you all think of this? Is the purpose of this website clear when you first look at it? And feel free to type in a yes or a no. Or you can shake your head or nod your head. Confusing. What is HUD? Someone thinks it is clear. Someone thinks it's confusing. Not clear and also busy. There are lots of pictures and colors going on. I would agree with that. And so if you're thinking about the audience for who might approach this website and use it, it doesn't say what HUD actually does. That's what Jocelyn wrote in. So it's about all people at all stages. So that's true. It does kind of show you that it's for a wide array of people. So there's diversity in the pictures, which is good. But if you're talking to about people who might need housing assistance, they might, if you're just kind of thinking in general, that audience might not know this jargony term HUD. Amy wrote, why do people say humans? That seems weird and impersonal. Yeah, kind of an odd word. So I think a lot of you are getting this is kind of vague. You know, if the audience is not working in government or public health, then they might not be familiar with HUD. So it's actually an example of unclear communication. How about this next one? Is the purpose of this any clearer? It's family focused, someone says. Picture of a family, of a young family. Connie says, yes, it's better. What does uplifts communities mean? So there's some vague wording possibly. Uplifting communities could mean anything. I think the main thing here is that they got rid of the HUD acronym and actually wrote this phrase right up front, helping you meet your housing needs. So it's very clear that this is something about housing. So if a client, if a patient got to this page, they would say, okay, well, this is in the ballpark of what I need if they're looking for housing. So some people are agreeing that it helps with housing. It's clearer. Exactly. The next point, so that's our first tip. Our second tip is to make your content easy to navigate. This is one of the most important principles, but it can be really hard to get this right. This is all about what information you provide and where you provide it. How do you organize your material? So by navigation, we mean organizing it so your readers can easily find what they want. Many users with limited literacy and health literacy read only the first few words of a page, and then they can scan in a very inconsistent pattern, kind of looking at things that attract their eye. They're not skilled at reading in an organized, kind of systematic fashion that people with higher literacy do. So it's really important that you get to the point quickly. On each page and in each section, the most important information should be first. This usually includes the purpose of your material and any action items. And then you follow that up with the least important information towards the bottom, like background information, or you delete that as much as possible. And this is where this becomes kind of an art. What can we pull out of here? It's kind of like a puzzle. What can we get rid of? We spend a lot of time doing that in materials that we create. So you also want to think about providing just need to know information, not nice to know information. So need to know information is, for example, motivational text or a due date to return a form. So here we have the COVID vaccine is safe, works well. Millions of people worldwide have already gotten it safely. So that's need to know information if that's the purpose of your material. Nice to know information is such as when vaccines were developed, prevalence data about a health condition. Since 1985, 25 million people have developed this disease. Like that type of information is not actionable. It's usually not key to your point. And so you do want to link every single point in your material back to your purpose. It's really all about what are you trying to teach people and what are you trying to get them to do? And this takes discipline and practice. So the next strategy for making information easy to navigate is to use large, bold headings. Very simple advice, but it can make a really big impact. You want to build levels of information using titles, headings, and subheadings so your readers can easily scan for the information that they want and that fits under each section. So you'll notice in this example that there's a title about the flu, and then there's these kind of reddish colored headings that are the subheadings. And then it's broken down under those into multiple smaller headings in blue. So the information is very organized and someone can easily scan these headings without reading a lot to see what information do I want to know, what's important to me. And again, a really easy tip that can make a big impact. Headings and questions are also a really great tool. Your readers will skim to find the exact question they're looking for, the information they want to know. And so this really helps them out by adding these signposts and making them a question.
And Megan, we had a question come in the chat about if the presentation from today's training will be available. I believe it will be available along with the recording. We will talk to the team we're working in the Kansas City Health Department to make sure that that gets sent out to everyone.
Okay, great. One more little tip under making materials easy to navigate, which is using bullets. So we see a lot of bullets in materials and they're great, but what do you think is going on with this material? There's lots of bullets. Does this help you navigate? Do you think that this is a problem? What are your thoughts? Too many words, not easy to read, too text heavy, people are saying. Limit number of bullets per subheading, doesn't organize, prioritize information. So you all already know this. So exactly. It's hard to scan a long list of bullets, even though it's a problem. Someone wrote it's a problem for visually impaired, it's overwhelming. Even though they're using bullets, so they're breaking up the information in a nice way. This is much better than a big paragraph. It's still too many bullets on one page, which is what Deborah said, which is correct. And so here's a better example of a way you could do this, which I think Taylor or someone mentioned, breaking it down into subheadings. Again, just break it into meaningful chunks. So how can you organize these bullets into kind of related chunks of information so that people can digest one concept at a time? And that's another low literacy principle when you're working with people who might have low literacy or language barriers. They tend to process slower as they're reading. So if you can break things down into one idea at a time, create some white space in between each idea, that can help them process. So some tips for using bullets are keep your list to 3 to 5 items. If there's more, then you should start thinking about subheadings. Each bullet should be 1 to 2 phrases or sentences, but not paragraphs. And if it does happen in a certain order, you will switch to numbers instead of bullets if it's sequential. So for example, you would list number 1, get your first vaccine, number 2, get your second vaccine 3 weeks later, and number 3, get your booster shot 6 months after your second vaccine. So those are steps in a process. So instead of bullets, help people understand that there's 3 steps by using numbers. Next, clear words and sentences. This is also can get really, really tricky. We probably spend most of our time when we're editing and writing health materials on these last 2 tips, how to organize and reduce the scope of the information, and then how to say things super clearly in a culturally appropriate way that meets the reader's needs. So the first tip is to avoid jargon and technical words. Sorry, I think I got off script for a second, but yeah, there you go. So for example, you want to replace immunization, which is a long word. It's also going to increase your reading level. We're going to replace that with just a vaccine or a shot. And you'll know what word to use if you know your community and the people that you serve. What do they tend to use? Some people might say a shot. Some people in their community might use vaccine. So you always want to be, just like I'm sure all of you do, kind of keeping your ear out for what are the terms that this group uses. It's probably not immunization. That's more of a clinical professional term. If the audience needs to know the jargon, if it's a term they might hear, Amy wrote in England, they say jab, which is true. So definitely a different cultural and linguistic practice there. You wouldn't want to say vaccine or shot. You'd say get your jab. You want to define jargon that the audience might hear and might actually need to know. So this isn't all about getting rid of any kind of technical term. It's really about what does your audience need to know, and in a way that they'll understand. And so for this, if they might come across antibodies in their reading or in the material that you're giving them, you might want to provide them with the definitions or proteins made by your immune system to help fight disease. We would probably go further there. You define immune system, explain how it works. That can get really complicated. So again, then it's a question of, do they really need to know antibodies or not? So it's really thinking through. Unfortunately, there's not just a one stop answer for all of this. It really depends on your material, your audience, your purpose. And also here, feel free to add any jargon terms that you come across that are difficult for you or that you've figured out a way to work around or replace. That might be interesting for the group. We have a little exercise as you're thinking through that. Here are some jargon terms. This is mostly around vaccines, which we're focusing on in this training. But read through the jargon terms on the left and then write in the chat any alternatives or things that you might say instead or ways you might define it. So what are your thoughts about administer? Yeah, give, clearly just to give. Inhibit, stops, yep. And chronic, which is, you'll see a lot, but people don't always understand that term. Long term, exactly. Subcutaneous. Ongoing is also good for chronic. Under the skin, under the arm for subcutaneous. You all know all of this stuff. This is really good. Acquire. Yeah, just to get. Contact, when you're talking about, have you had any contact with someone with COVID? Has something contacted your skin? Exposed. In the presence of, Meg, what do we say for contact? Touch. So it depends on the meaning of the word, but been around someone is a good one. I see someone wrote that in there. Been close to, been around someone, touched something, if it's more of a contact virus or material. And then adverse event. Complication, side effect. Complication can be difficult for people. We tend to use side effect or health problem. But adverse event is definitely very jargony. Would not use that. A health problem that happens, a side effect, a bad experience. I see someone wrote. Okay, great. Thanks. The next point in using clear words and sentences is to use active voice. So do you remember active and passive voice that, from school that we learned about? So active voice means that the person or object doing the action comes before the verb. It makes your writing much more direct. And it's the opposite of that really stilted language you might read in like a medication insert or corporate policy, like the medication should be taken or not following guidelines will result in. It clarifies who's doing what. So here's a little quiz. Read the two phrases below and then decide which is active voice. And so you can hold up or type in one if number one is active, and type in number two if number two is active voice, where the actor is first. Phrase two, people are writing phrase two. Phrase one, phrase two. And so this active voice is really all about how would you say this to someone? If you were in front of a parent who you were talking to about getting their child vaccinated, any type of vaccine, to be really direct and really like look into their eyes and say it how you just say it. You could say the vaccine will be given to your child at school. That's okay, it's clear, but it's not as direct as your child will get their shot at school. So number 2 is the active, number 1 is the passive. And it's kind of a subtle difference. And it doesn't really mean that someone won't understand it, but if you pile up a lot of passive sentences together, it's going to become really lengthy and really feel very kind of impersonal and indirect. But if you're using the subject and saying your child, you, your family, it becomes more personable. And I'm going to start to move a little bit faster because we're getting on in time. So the last point in clear words and sentences is to tell stories. This is kind of like a secret weapon for better health communication. And especially when it comes to talking about vaccines, there's a lot of new research out that shows that telling stories and using profiles like this can really help people feel the emotion and get in touch with kind of how they feel about a vaccine and communicate more clearly and then think more clearly about their decision. And as far as narratives and stories, we're hardwired to make sense of the world around us primarily through stories. So a story about how the COVID vaccine is allowing families to reconnect is more persuasive and compelling than explaining the efficacy behind a vaccine or how it works. That can kind of pull your readers in telling a story, and then you can provide them with more facts. The downside to narratives is that because that narratives and stories tend to stick in our brains, we tend to remember stories that we've heard. Negative stories can stick in people's minds, and they might remember someone told them about a really bad response to a vaccine or something. So a great way to counter that is to tell a positive story or give very simple positive data, like how many millions of people have safely been vaccinated, to kind of try and unwind a little bit of that story in their mind. And then our 4th strategy is to keep your action steps really specific. So instead of saying things like maintain social distance, use good hand hygiene, you might say something like, in public places, stay at least 6 feet away from other people. It's about the width of a car. And we can talk in a future training more about how to explain numbers like 6 feet away by using little comparisons like that. Use good hand hygiene. That means different things to different people. So being really specific, telling them what type of hand sanitizer to use, when to use it, how to wash their hands. Again, instead of saying 20 seconds alone, also give them a comparison. Sing happy birthday in your mind twice. And then the last item in our clear materials section is using clear design. And so we'll start with this often neglected aspect of spacing. But we all kind of have the same immediate reaction when we come across a material like this, which is more rare these days because designers are starting to understand these principles. But when it's full of text and tiny, tiny margins, no open space, it can be really hard for people to process the information, and they're more likely to just move on. So white space is the term for areas that don't have any content. We recommend that you use about 20 to 35% white space to give people's eyes some rest in between the concepts. And so here, how about this next one? This one uses a lot more white space. You can see that it's broken down into chunks with headings, which we've talked about, numbered lists, which we've talked about, and then a little bit of white space in between each item to let people know that they can move through conceptually one by one. Also, there's white space around the document, so it feels less overwhelming. Any designer out there or anyone who works with designers knows that fonts are really important. There's so many different types of fonts. People feel really differently about them. The first rule for using simple fonts is to use sentence case, not title case. So title case will have all of the words capitalized. Sentence case will just have the first letter capitalized, and avoiding all caps too. A lot of low literacy readers tend to recognize words based on the shapes of the letters. So if you use lowercase, that's what they're more used to. If you switch that to uppercase, it changes the shapes of the letters. For example, an uppercase A and a lowercase a have very different shapes. So they won't be able to recognize the words as well. Also, it seems like shouting nowadays when we use all caps. Typical basic sans serif fonts are recommended. Arial, Calibri, any of those listed, Verdana, any of the kind of basic sans serif fonts are great. You want to just avoid the decorative specialty fonts, avoid italics, avoid underlining. That can all kind of obscure the letters. And you want to use at least 12-point font. If you're working with older people, I would say 60 and above, 65 and above, you might want to switch up to 14 and consider 16 size font for websites. The last item here is to use meaningful visuals. And this can be a photograph, a drawing, a film clip, chart, any type of graphic used to tell a story or convey a message. So they should be relevant and meaningful. You don't want to distract ever from your message or your purpose. High quality, obviously, crisp and clear, positive, diverse, accurate, current and not dated. So for example, you might want to start showing people with masks on or with more updated phones that lets people know this is a current material. People find that health materials that don't include people that look like them don't apply to them. And so there is evidence to show that people prefer pictures and health messages that are representative of themselves, both in terms of what they look like and the setting they're in. Studies also show that pictures describing how to take an action, such as how to take a medicine versus just showing a medicine bottle, or how to get a shot versus just a picture of the shot, can increase readers' understanding. So making action specific, but also providing a visual to support it. And because culturally appropriate materials are so important, we really recommend testing your materials with your audience. There isn't always time to do that when you're making materials quickly, but it's a great way to just tweak your material a little bit more to be more relevant for your audience. So for example, in the US, we might use red to indicate a warning or an emergency, but in China, red is associated with good fortune and happiness. So if you're speaking with a Chinese group, a Chinese American group, that might make a difference in how they interpret it. Okay, I'm moving a little bit quickly. We have about 13 minutes left. So we're moving on now from creating clear materials to tips for speaking clearly about health information. And it sounds like from the roles and the work that a lot of you are doing, both of these are relevant. It seems like you might make materials, but also speak with people in your communities. So the tips we have are approaching people with an empathic and collaborative approach, and we'll cover these 4 tips. So the first is to build rapport. And a lot of you know this. If you're out in the field and you're working with people, this is what they train you on as a community health worker, as a social worker, building rapport, taking a non-judgmental stance. And a lot of you are experts at this. So first, you can reflect on your own state of mind. This means before approaching someone, really thinking about you're in the right frame of mind. You're able to listen without judgment. How's your mood? How do you feel about this person? What do you think this conversation is going to be like? Are you dreading it? Are you excited for it? And really kind of resetting your mind to a calm, open, and ready space. The next one is adopting an attitude of empathy. This can be very hard, especially as talking about vaccines just gets so contentious. People differ on their views. People believe misinformation. It's frustrating. But as much as you can, trying not to argue, trying not to debate, staying really open and empathic, respecting people's feelings and values, even if you disagree with them. So taking the time to kind of imagine yourself in their shoes can help you. And even repeating things that they're saying to you. If they're saying that something scares them, that they don't believe something, kind of repeating that back to them. Is that what you're saying? Am I hearing you right? Can kind of help you build that rapport. Next, using verbal skills to show that you're listening. I'm sure a lot of you do this all the time, not interrupting people. I see, I understand what you're saying. Also positive body language. So remaining very open, not crossed arms, not crossed legs, but having a more kind of open, direct body language facing someone. Comfortable eye contact, which is different culturally. So in the US, we think that eye contact is respectful. We try to make eye contact. It's strange to us when someone avoids our eyes. In other cultures, it can be kind of disconcerting. It can be rude. So, what are those cultural norms? And that's that same thing. Yeah, about culture. Okay. Validating feelings. So these are kind of in a sequence. So the first thing you want to do is build that non-judgmental stance. You want to then validate people's feelings. So you're approaching the conversation or the meeting or whatever it is you're doing in an open way. Now you're going to really be paying attention to the feelings in the room. What are the emotions behind the words that people are using? So for a lot of people who have not been vaccinated, they have lots of reasons for it. Validating these reasons can help lower stress levels and help everyone feel less defensive. So here's an example of a conversation you might have with someone about vaccines. So would you like to get the COVID-19 vaccine for your child today? Well, when it comes to our children, everyone is emotional. We love them. We want to keep them safe. Finding a common point of empathy can build trust. The person might say, no, I don't think so. I heard it means that they can't have babies. There's fertility issues. I'm not giving that vaccine to my child. So the next thing you might want to do is try and validate that feeling. It sounds like you're really concerned. You're worried about your child. Thanks for telling me that. It tells me how much you really care about them. You're worried. And then asking permission to share information. So giving them that control. Would it be okay if we talked about this? Can I give you a little bit more information? I understand where you're coming from. So you're coming with an open stance, you're validating their feelings. The next step is to give them facts in a very simple way. This can be really hard. There's a lot of information out there, but leading with a fact. The vaccine is very safe. And then if you're going to repeat any false information, you want to tell them ahead of time that false information is coming. So there's a lot of false information out there, like on social media, about vaccines causing problems getting pregnant later in life. There's no evidence for that. That's not true. In fact, vaccines have helped get rid of diseases that could be dangerous when someone is pregnant, like measles or something. So correcting misinformation, but being careful about not repeating a lot of misinformation back to them. If you're going to repeat it, give them that warning. I'm going to say something that's not true here. People say that it can cause fertility problems. That's not true. Here's what is true. It's a good idea to have some basic talking points from credible sources ready on hand, or like from the Kansas City Health Department or from the CDC. They have a really great COVID website that has all kinds of tips and tools. Having that prepared either in your mind or a handout can really help. It can also help eliminate our own biases and reduce our emotions during these tense conversations if you're just handing them facts or you know the facts that you want to share. I was hoping we had more time today to hear from you all about how your conversations go in the community. If you have found anything that's really helpful, I hope we have just a few minutes at the end to talk about that. But the last tip is to use teachback. And this is only appropriate when you're really teaching someone a skill or something to do. And so here's how it works. You explain a new concept, here's how to do X, ask them to explain it back to you. Now I gave you a lot of information. Can you tell me what you're going to do? If they explain it correctly, great, you can move on. If they don't, try to explain it again using different words or pictures, and then ask them to explain it again, kind of go round and round until you feel like they understand it. So here's an example. I want to make sure I clearly explained everything. Can you tell me, when do you need to get your second vaccine shot? The person might repeat something back that's incorrect. So then you might say, well, you almost got it right. I don't think I was totally clear. You need to come back, and then you give them the information again. This is also a great way, great time to draw a picture, to draw like some sort of simple timeline or schematic, or you give them a handout that you have, then ask them, okay, try it one more time. Now tell me how you're going to get your shots. And then hopefully they understand, they explain it back to you correctly, and you feel like you've taught them, and you've kind of used this method to help them remember. So we did kind of rush through those last few points. So the last section is just to share some resources. As I mentioned in the beginning, there will be a handout to supplement this training, and that will have these resources listed on it. So you do not have to type or write all these out. The first chunk is about just health literacy in general. And the second grouping is about communicating about vaccines. The CDC has just really amazing resources if you don't know about those. So this will all be on your handout. And lastly, we do have about 4 minutes. I wondered if anyone wanted to share anything that is on their mind right now about tips that have helped them, or things that are difficult for them that they can't figure out a strategy for in their work. We have a couple minutes to discuss. So feel free to share if you have anything. The next webinar will be on clear health materials. So we'll dig deeper into that first section about how to write materials, and we can cover numeracy and data in there. And then we'll move on to different topics after that. So I'll give you a couple minutes if you'd like to share anything.
Hey, Megan, this is Connie. I just wanted to thank everybody for joining us today. And as you've been noting, there will be additional workshops, and we hope you all can join us and invite even more guests so that we can share these tools to many more in our communities. Thank you.
Great, thanks, Connie. Yeah, I see some comments coming in. Thank you, everybody. Hopefully in our future workshops, we're not going to cover as much material. This was kind of an overview, so we can leave some more room for discussion, because we really would like to hear from you more about what you find helpful, where your needs are, where the gaps are in your work that we might be able to supplement, and also what we can learn from you and from what you're hearing in the community. Oh, and one more point, we'll also be sending out a survey afterwards that you'll get a link to. So if you'd like to, please fill that out to tell us how the training went, and then also additional topics you'd like to learn about.
So we have some folks putting their email in the chat, and just in case you don't have our contact information, please put your email in the chat so we can continue to send the information about future workshops. Thank you.
Great. I see some more emails coming through, so we'll leave it open for a few more minutes if anyone wants to enter their email still. But thank you all. You are released. You are free to go. Thanks so much for your participation.
Thank you, ladies. Great workshop.